Hello, my name is Dr. Claudia Brown and I'm a specialist periodontist. So you might be thinking, what is a specialist periodontist? Well, I qualified from Guy's in '99 and then I went on to do various different things like hospital jobs around the country, community jobs where I worked as a dentist treating special needs patients, treating patients under general anaesthetic, and then I also worked in general practice as a general dentist. Then about 15 years ago now, I started my specialist training at Guy's. So you can see I've got a wide range of experience in almost every aspect of dentistry. And here I am now working as a specialist periodontist at Dental Artistry. So one of the other things I do, I also examine postgraduate students for the Royal College of Surgeons. I do quite a lot of voluntary work, be it helping the homeless, working in soup kitchens, but also going on voluntary trips abroad. So this year I should have been going to Jamaica. I was going to bring a team of about 20 people out to actually serve the underprivileged people in Jamaica, but hopefully we'll be doing that next year. I've done quite a lot of research into the link between gum disease and general health, and I know that that's a question that quite a few people are asking. So there's been quite a bit of research looking at gum disease and heart disease, and the reason why they're looking at that is because they've got very similar risk factors, and sometimes if you have gum disease and your gums are inflamed, then that increases a certain level in your bloodstream, and that can perhaps make you more prone to having heart disease. And there are also links between gum disease and diabetes, gum disease and osteoporosis, dementia, all sorts of issues. And this is why it's so important that you still attend for your general checkups with your dentist so they can assess your gums and just make sure that your gums are nice and healthy. So you might say, how will I know if my gums are nice and healthy? So these are certain things that you need to look out for. That if you notice that your gums bleed, either spontaneously or after brushing, that could be a sign of gum disease. If you've noticed that your teeth are moving, that they're drifting, or they're slightly out of line, or that they've moved in such a way that it might, you might feel a bit less confident about smiling, or even eating may become an issue, then that's very important to see your dentist. If your dentist picks up that you have gum disease, you might be referred to someone like me. So that's my specialization, where you come and see me, we do a full examination, we have a really good look at everything. But before I look at you, I'll ask you a series of questions to just make sure that everything's okay, find out what your concerns are and how we can help you. Sometimes people feel embarrassed because they haven't been to the dentist for a long time, but we always say here at Dental Artistry, there's no judgment, we just don't look back, we look forwards, and we are here to help. During COVID, it's been quite difficult for some of you to get to the dentist, and we fully understand that. So some people have been experiencing a few problems at home, would have noticed that things are bleeding or funny taste in their mouth, or that sometimes but their teeth may even feel a bit loose. So we have done some research and we've had a look at some of the questions that are concerning people. So who is prone to have gum disease is one of the questions that someone has asked online. So 80% of the population suffer from some form of gum disease, be it gingivitis, which is just for the gums, or be it periodontitis, which also involves the bone. But sometimes you can get gum recession, and that's also another sign that you could have gum disease, although there are other causes to gum recession. So there are certain risk factors. If, say, maybe over lockdown you weren't able to access your usual cleaning aids, then that might be a risk factor because you may have a bit of plaque buildup. So again, that's why it's very important to come see someone like myself who's a gum specialist or your general dentist to have this further investigated. Also, if you have a family history of gum disease, that's also very important because periodontal disease can be genetic. So if your mother or your parents or anybody else has an issue with gum problems, then again, this may well need to be looked into, especially if you're experiencing certain symptoms and signs like bleeding gums, uh, wobbly teeth, receding gums, any change, any gaps suddenly appearing, or that your teeth are starting to overlap, this is very important to get that checked. Also, if you're diabetic and this isn't very well controlled, that can also make you more prone to having gum disease. And also, if you've got any immune issues, if you're ill in any kind of way that can affect your immune system, that can have an impact. And also stress. We fully understand that over COVID, it was a very, very stressful time, and we're still going through it now. And this can sometimes manifest as a gum problem if teeth start to move, or you even get a toothache. But with gum disease, it's usually silent. So because you have pain doesn't necessarily mean that there's definitely gum disease there. That tooth pain could be due to a number of other things like decay in your teeth. So again, very important to see your dentist. There are two different types of gum disease. You've got gingivitis, which is reversible, and the signs of this are if your gums start to bleed or you have a funny taste in your mouth. And there could be a number of reasons that your gums can start to bleed. It could just be simply that we just need to tweak what you're doing at home with your cleaning, or it could be that, say, if you're pregnant, sometimes in pregnancy you get even more bleeding, but we will talk about that later on. But the main thing to remember with gingivitis, it's reversible. Now, there's another type of gum disease which is called periodontitis, which means that the bone is affected, where you lose bone around the teeth. And signs of this could well be that, again, the gums are bleeding. You may notice that the gums start to move. You may notice some pus coming out of the gum. And this one is irreversible, but with the correct treatment and the correct intervention, which usually involves, first of all, with you changing what you're doing at home, and we tweak your methods of cleaning, where if you're using a normal toothbrush, a manual toothbrush, we may encourage you to use an electric toothbrush, encourage you to use little brushes between your teeth and floss between your teeth, and then we do some deep cleaning around the gum. So either we just do a deep cleaning as you would normally have, where we either do it by hand or with something called an ultrasonic, or we also use a water lathe here at Dental Artistry. And the water lathe is used in addition to our normal deep cleaning. But we've also got other things that we use here, like airflow, perioflow. So we've got a whole load of things to help bring your gums to a healthier condition. The risk factors with gum disease is smoking. It's very, very important, if you smoke and you smoked for a long time, that you at least reduce, ideally stop smoking, because what happens is when you smoke, you have less blood supply going to the gums, and the blood contains all the good stuff, all the nutrients. So if you have less of the good stuff going to the gums, then your gums are more likely to become infected, diseased, and you get a form of gum disease where your teeth may start to loosen. You don't necessarily see any bleeding as you would normally see in gum disease because you've got less blood supply there. And smokers are more likely to get a severe form of gum disease. Some people say to me when they come in for the initial assessment, my gums were fine before I became pregnant. And the reason being that when you're pregnant, or any changes in your hormones, even as a teenager, when you're going through those different stages, your gums tend to bleed more because there's an imbalance of the hormones. Even as well, women who are going through the menopause suddenly find that they have to come and see me because their gums have suddenly gotten worse. So again, when you're pregnant, it's very important to see your dentist on a regular basis. Keep a close eye on your gums and make sure that you use your correct toothbrush, see the hygienist so they can go over the different TPs and things that you need to use. Also, if you've had a history of gum disease, of periodontitis, where you've lost bone around the gums, it's even more important for you to see someone like me who's a gum specialist, or your dentist, hygienist, to make sure that we keep a very close eye on the gums, because there has been a link between pregnancy and certain complications in pregnancy. But again, nothing to alarm you about with that. But again, as long as you make sure that you keep your gums nice and healthy, because there is a link between your gums and general health. Thank you so much for sending all your questions, and I know that it's a big concern at the moment, especially with COVID, and people have been noticing that they've been having more issues with their gums than before because they haven't been able to access the dentist or even to come and see me as their specialist periodontist. So we just want you to know that we're here to help. We're here to answer any questions, and we'll do our best to answer any questions that you may have. So just very important, keep brushing, keep your mouth nice and healthy.